Right. Do we want to get started? And people might join in a couple of minutes.
Yeah, sure, will do. Thank you, Una. Hello, everybody. My name is Barry Causer. I'm the Head of Strategic Commissioning in the Merton Council Public Health Team. And Una is with us tonight, who also works in the Public Health Team of Merton Council. Thank you for giving up your Wednesday evening. It's really appreciated. And we're going to do our best to make tonight's session a really interesting, informative session. So, people are slowly joining the meeting, but we're going to start because we're on time. So next slide, please, Una. So our agenda for this evening. This is the second time today that Una I'll slow down for you. This is the second time today that Una and I have delivered the slides. So you can see on the agenda there that we did it at 12 noon today, and we had 20 people dropping in earlier today, which was really positive for us. So we're going to give a brief intro. I'm going to give an overview of some of the key messages this week for Merton and across London. Then I'm going to hand over to Una, who's going to talk about who are the champions, what role do they have, and how they help protect us and help keep us all safe. Then we're going to have a short discussion and feedback on last week's theme. So those of you that attended last week's session, we had a discussion about the app, the COVID-19 app. So we've got some questions and we'll have a discussion about the app. And then we're going to have tonight's theme. So we're going to spend 10-15 minutes presenting some, we're going back to basics tonight, actually. And we're going to talk about those really simple but effective things that keep us safe within Merton. And then we'll answer some questions and we'll hopefully have a rich discussion with our champions this evening. And we will finish by 8 p.m. at the latest, I promise you. Okay. Next slide, please, Una. So I can see many of the names on the participants list, and I recognise many of them. But welcome to our new champions that are joining us for the first time this evening. So what we'd ask people to do is just introduce yourselves in the chat box. So tell us who you are, why you're a health champion, but also thinking about those key messages. So if we have a key theme at each of these meetings, so last time it was the app, this time it's about those simple key things that keep Merton safe. What would you like us to discuss in future meetings? So you might want to do that, or perhaps a bit later on in the agenda. Okay. Next slide, please. Housekeeping wise, I think it's just Una and I have got our cameras on. That's absolutely fine. It's absolutely up to you whether you want to have your camera on or not. If you could keep your microphone on when you're not speaking, that would be really helpful. But I would really encourage you to use that chat box throughout the workshop for comments, suggestions, ideas, and any questions. And so Una and I will do our best to answer those questions in the discussions. If you want to put a question in the chat box as well, we'll do our best to answer them tonight. But it is quite a packed agenda. And so what we might need to do is to answer those questions that you pose to us in the notes which we send out to you on a Friday. But we will definitely answer any questions that you have. Okay. Next slide, please, Una. So these are this week's key messages, and so I think these are a really important part of our engagement and discussion with our Merton community champions. And what I can say is that positive cases are increasing in Merton. The numbers within Merton are relatively low compared to other London boroughs, but they are increasing. And those increasing cases will have a knock-on effect on increasing the number of admissions within hospital. And this virus is no less lethal. So it's really important that we take these messages on board. And again, the cases that we're seeing increasing within Merton, clearly we have surveillance systems in place. And the cases are increasing in a broader range of, it's affecting all age groups within Merton. It's no longer just young people that are going out socialising that are having a knock-on effect. Many of you would have seen also the announcement last Friday by the government, where London has been identified as an area of concern by the government. So I thought it'd be helpful just to give a bit of an overview on what that actually means. Essentially, every Friday, the government they make an announcement on which areas are of concern. And then the next tier above that is an area of enhanced support. And then the third and final highest tier would be an area of intervention. So London has come together, which is really important to say, as an area of concern. So it's that lowest rung of concern, but it is still a concern for us all. And this recognises that challenges around London that we face as Londoners. So you might live in Merton, but work in Wandsworth, and your children might go to school in Sutton. So that's exactly kind of why London has come together as an area of concern. So this makes it absolutely really important that we follow the guidance. And we're going to talk through the simple messages and the simple guidance a bit later on this evening. And you may have seen Boris Johnson speaking a little bit earlier with the Chief Medical Officer and Chief Scientific Officer around the concern and the absolute need to now follow that guidance so that we don't increase in those tiers of concern. One of the benefits, if that's the right phrase, of being identified as an area of concern in London is that it brings additional support. And in this case, it includes additional testing capacity. We've all had problems accessing tests. Hopefully that will be eased slightly by London being notified as an area of concern. But that third point on the slide there, and we send the slides out to you on Fridays, so you'll be able to see these again, is really important. That testing is available across London, and you should only request a test if you have symptoms. This is really important. These are valuable resources, and we should only use them appropriately. There are some other ways that you might be asked to use a test. For example, if you're going to go into hospital, the hospital or your GP or your clinician might advise you to take a test before you go in, and that's absolutely fine. Maybe in the future, we might, as a local authority, ask you to take tests even if you do not have symptoms, but that's not the case right now. Or perhaps you might be taking part in a government pilot project. But right now, request a test if you have symptoms and for no other reason. We spoke about this last time, the COVID-19 app. I'm really interested to hear your feedback, so I'm going to try to get through a little bit faster for you. But the app we heard yesterday has been downloaded 13 million times so far across the country, which is really positive. The key thing for us is that the more people who download it and use it, the better it works to protect us. So I'd encourage everyone to download that app. And again, we can have a conversation shortly about how you felt the app has gone down. Another key message for us within Merton, our schools are open. Our schools have worked exceptionally hard. They've been supported by the borough, they've been supported by Public Health England, but the leadership shown within those schools and those head teachers have been fantastic on developing those risk assessments, because returning to school is absolutely critical to children and young people. And the final key message from me, just before we hand over to Una to talk about the champions and the theme tonight, is really about these simple messages, which all of tonight's about. The most effective way of helping to stop the spread of coronavirus is by following those guidelines. And these guidelines are relatively simple. So they are about social distancing. It's about the rule of 6. It's about wearing face coverings, and it's about washing your hands on a regular basis. Hopefully, in the future, we'll be able to talk about vaccines and things, but right now, these are the things that help protect us, our families, and our communities. So I'll stop there and hand over to Una, but what I would encourage you to ask any questions in the chat function if you have any comments or questions, and we can go through the agenda as we go through. So Una, I'll hand over to you, please.
Thanks, Barry. So I'm just going to recap on who the COVID-19 champions are and what they do for our champions that attended last week, and for any new champions that this is their first drop-in meeting, we can just run through the role of the champions. So who is a COVID-19 champion? Anyone who lives or works in Merton and wants to help stop the spread of COVID-19 by sharing clear and consistent messages from the NHS and public health can be a COVID-19 champion. We have champions. Currently, our champions, we've got quite a broad representation. So we have residents, councillors, service providers, officers from the council and the CCG. We have VCS reps, clinicians, and more. So we have a really good broad range of COVID-19 community champions helping spread those messages. And And the champions came about as a response to our community engagement workshops that were held back in August, where we heard that the community wanted to help support local efforts in helping stop the spread of COVID-19 and to help share clear and consistent messaging as well. So that's kind of who our champions are in a nutshell. And the role of the champions is quite simple. It's 3 steps. So you'll receive key messages, you'll spread the word, and you'll feed back to us. So the first step, receiving the key messages, you can receive these key messages through the drop-in sessions on a Wednesday, either lunchtime or in the evening, and with our weekly email that we'll send out on a Friday, and we'll share key messages with some resources that you can use, videos, posters, information and guidance. And it can be, we're working on delivering it in multiple ways. So at the moment it's via email, but we're working on having being able to send it out via text message as well, and having those different versions. So we'll have videos, images, easy reads, and multiple languages as well. And so the second step is sharing the messages and spreading the word. So the champions can share these key messages with anyone, family, friends, community, networks, sports clubs, anyone that you can share these messages on. And you can share them in whatever way is easiest for you. So that can be verbally if you're speaking with people. You can, if we send you posters on a Friday, you can print them off and put them up in your windows, or if you have a shop, you can send them via text message or WhatsApp, or send them out in email, whatever way is easiest for you. And the third step is feeding back to us what's working well and what isn't. And you can feed back to us at these sessions. We have a couple of minutes, we've got 10 minutes after this bit of the presentation, where you can feed back to us what's worked well from last week and what hasn't. And you can ask any questions as well. That's really important. You can ask us questions at any point during the week by sending us an email. I think most of you have my email address, and we'll put it, show it up as well at the end, or you can email the public health email address, or you can ask the questions at the drop-in sessions, whichever is easiest for you. And it's really important as well to feed back to us. It can be in these drop-in sessions, or again via email. What's working well? What are the issues in the community, and what do you want to see from these drop-in sessions in terms of themes? Yeah.
Una, sorry, carry on.
Yeah, sorry, no. What were you going to say?
Sorry, go on to the next slide. I'm going to ask everybody to introduce themselves, because we've got a nice small group, so we can get a bit of a discussion started. Okay, you carry on for the moment.
Yeah. So what the COVID-19 champions do not do. So the COVID-19 champions, community champions, are not public health specialists or COVID-19 experts. And we don't expect you to be able to answer every question that you're asked when sharing this information with your family, friends, community and networks. So like I said in the previous slide, if you have a question and you're unsure of the answer, or you don't know the answer, you can email us at any point during the week, or ask the questions here, and we'll get back to you as soon as we can, quite quickly. We won't leave it too long, because it's quite important that you feel confident that you're able to share that information. So yeah, the email addresses are up here as well, but we'll share these with you on Friday, so you'll have them. So getting into the feedback.
Can I come in here, Una? Sorry.
Yeah.
Just before we start that feedback, because we do have such a small group this evening, I think it'd be really great, because we can't do it when we've got 20 and 30 of our champions on the group, but because we have got such a small group, I'd like to bring everybody in just to kind of introduce themselves, if that's okay. I'm going to go in alphabetical order, because that's the list I have. Angela, would you like to unmute and say hello to the group and tell us a little bit more about why you're a health champion and where you're from?
Hello, can you hear me?
We can, Angela.
Yes, I'm Angela. I sent Una an email last week. Why I decided to come on because I work with vulnerable adults. So I thought, come on here to see if there's a way of explaining the information simpler to the clients I work with without all this government jargon.
Yeah, we need to make it far more simpler for people to understand.
And also I was feeding back as well, because it's all good you're doing these apps and blah, blah and everything. But I just thought this was going to be like simple, because like with the mask, a lot of people not wearing a mask. It's like simple information where you should be wearing a mask like this, because then it's protecting you. Having it under your nostril or under your chin or whatever is not working.
Okay, we're going to come to that. We're going to come to that, definitely.
Yeah, it's practical information, because I work with the homeless, people with addiction. So these are the people you're telling the information the same time, but they're not keeping it in.
I understand. Yeah, let's come to that. That's a really important point, Angela. Thank you for joining us.
Okay, thank you. This is my third time.
Oh, no, it's great. I'm really pleased that you're here with us tonight. Calvin, would you like to introduce yourself for us, please? Calvin, are you there? I'll come back to Calvin. Eleanor Robinson. Eleanor, would you like to introduce yourself?
Hello, can you hear me?
We can, Eleanor.
Hello. Sorry, I'm trying to get my kids to go to sleep.
Oh, sorry.
So I can't talk for long. My name is Eleanor Robinson. I work for Merton Council, and I primarily in an information sort of sharing role. And so basically, as part of my job, we run a Facebook group, which is quite small, but it's got about 400 parents.
Wow.
And then we also have contact with all of the Ofsted registered childcare providers. So when I saw the message, I thought, well, actually, hopefully maybe we could help. So that's why I put myself forward.
Eleanor, thank you. And sorry, I know you wanted to go on mute so you can help get the kids to sleep, but we'll bring back into the conversation later. Thank you.
Thanks so much.
Ian, would you like to introduce yourself?
Yes, hello. I've just asked a question, actually. I'm a resident of Merton Park and retired. And, I see different standards of compliance wherever I go. And I'd absolutely agree with Angela. The message about people wearing masks properly and how one can actually get that message across. And certainly in shops, I believe the requirement is that all staff who are out on the floor should wear masks. I'm afraid they're not. Okay. What should I do in those circumstances? And personal feedback on the COVID app. I found it really user-friendly, and it's also particularly useful for logging into gyms and restaurants, cafes, and that sort of thing. What more can we do to encourage the other 50 million to download it?
Absolutely. And I'm going to ask you that question in a minute, Ian. Thank you. Welcome. Thank you for joining us tonight. Karen?
Hi there. My name's Karen. I'm a resident of Colliers Wood, but I work in a different borough. One of the things I am interested in, because it was actually in the news this week, is because I work with international students and overseas health professionals. So I'm interested in how we get messages to these people and how we support them as well. That's another issue. How do we deal with people who are here for a short period of time and manage to get compliance? So you've got long-term international students and you've got people who are here for a shorter time period. And I think that's quite important at the moment.
Yep. Okay. Thank you, Karen. Thank you for joining us.
Well, just to say, I did download the app, and that, as the other gentleman said, it was very good for checking into places. Right. But a lot of people are saying to me that what they've seen on the news about all the problems has put them off downloading it. They're waiting for that to be sorted. Yeah. I believe it has been, but I don't think that message has been very clear.
Okay.
Not that's something I'll ask you.
That's great. Thank you, Karen. Sue, I know we're going over, so I think this is just really helpful and valuable for us all to kind of see where we're all coming from. Hello, Sue.
Hi Barry, I'm Sue from Age UK Merton. I coordinate a project there working with older people who might have hoarding or clutter problems at home, helping them to sort those out. But I've been doing quite a lot of work for Merton's Community Response Hub as well, talking to residents around COVID issues. And at the moment as well, we're carrying out an exercise of calling all of the residents who were previously shielding to make sure they've got access to food if they were asked to shield again, or if we went back into restrictions. So that's really why I've mainly signed up to this, because obviously I'm going to be working with people. I am working with people who have been shielding and who have been vulnerable. I think I downloaded the app as well. I haven't really been going many places. I'm working from home mainly. When I come back I'm going on leave from tonight actually until the 13th, but when I come back I'm going to be starting to do some limited home visiting. But I think my main issue about the app is really just that there's been a lot of publicity about how it can't record people's test results. And I don't know what implications that has really for the app. I'd like to have a bit of a discussion about whether that's, makes any difference
Thank you, Sue.
to its usefulness.
That's really helpful. Thank you. And apologies to Una for going totally off agenda by asking everyone to introduce themselves.
No, that was great. It's great to get to know everyone as well, and see if people's different perspectives of why they want to join the health or the COVID-19 community champions. So I think anyone that received our key messages on Friday, and apologies to any new champions here, but could you tell us if you found it helpful or unhelpful, or is there something that you would prefer to have seen? Do you have any thoughts on the messages that we sent out?
I have to say I missed them. Sorry. Because it just goes into an email box, and I actually do think a text might be. And so I was aware you were sending something, but I actually was thinking just the slides from today, or I think you need just the messages, it really clearly highlighted in a text, short, sharp, to the point, because I'm looking on emails for totally different other things as well. I'm sure a lot of other people are doing the same thing.
Great. So clear and concise messaging.
Why not a WhatsApp group?
We're working on it.
Do you know what I mean? I've got this, I'm a member of the Don's action group.
Yeah.
And loads of, everything happens on that WhatsApp. And actually it's quite engaging. It can be a right pain in the neck as well.
That was going to be my question for you, Karen. If I set up a WhatsApp group of 55 people, will it be pinging every minute of 24 hours a day?
But you can mute the notifications. But actually it can be quite supportive, and somebody can give you some quite immediate feedback on, I've just shared this message and I got a really interesting response. What should I do? I think it makes for something agile rather than something that's boxed and quite formal.
Mm-hmm. So can I ask the champions that have attended this evening, would you be interested in joining a WhatsApp group where we share those messages out of everyone here?
Yes, I would certainly, Ian.
Sue, I probably would join it, but I think I probably would have concerns about it pinging all the time, to be honest with you, because I've been a member of other groups where it eventually drives you potty. And I quite like this format where you can key in and actually hear and have stuff on the screen as well. But I probably would join it if it was available.
I think that's what we're working towards, is having a combination of using the emails so people, and when we asked you to sign up as well, we did ask you if I don't know if you remember, how would you like to receive the information, email and text. So we're aiming to work towards having both, and people being able to choose their preference. Okay, so that's really interesting. So it's quite a mixed response in terms of the WhatsApp group, but that's good. So I guess following on from that, is there anything we could do to make it easier for you to share the messages? So one of those things would be a WhatsApp group. For some people, it would be quite easy to forward those messages on into another WhatsApp group that you're in, friends or family. But is there anything else that we can do to help you share those messages that we send out on a Friday?
Could some of them be fun? I know that sounds... So I'm going to give you an example. On this WhatsApp group that I'm in, somebody said something about the app and I thought, okay, I'm going to come in now. I said, what a great idea, But it died. Nothing happened. Nobody... And that was unusual for that group. I don't think people really knew what to... And I thought at the moment, a lot of WhatsApp groups are memes and GIFs. They're fun, they're zappy, and they get messages across. I'm not saying everything, but if I'm going to send it to a family group, my family wants something a little bit, in an interesting... I think variety of the way the information is presented is quite interesting.
Yeah, I think you've hit the nail on the head there, Karen, in terms of if we send out an email, we can send out PDFs and posters and things that you can download. If we send it via WhatsApp, to make it appropriate to WhatsApp, so short, snappy, grabs your attention, if that makes sense.
Yeah.
And it's interesting, isn't it? So it's better coming in there that, that's a really interesting point about how we share, because the message that I put on my rugby club WhatsApp has a different type of message than I would put onto my community champions message. We need to tailor the messages to the audience, with all those segmentation and all those complicated marketing terms and various things. But that's a really interesting point, Karen. And we heard earlier today that we shared a video last time. I'm not so sure if people saw that, of a local doctor, Dr. Mohan Sekaram. And the individual said, well, actually, I didn't think it was quite appropriate it was an appropriate video, but she didn't think it would quite hit home to the people that she wanted to send the message to. And that was great. That was really positive. I've got no problems with that at all. So it's about perhaps us giving a diverse type of, relatively small, but a different range of type of messages to hit the audience. That's good. Okay, sorry, I'm interrupting again.
No, you're okay. I've just seen Eleanor has sent in a message as well. For her, shorter messages are best for how she's sharing them, and visuals are good as well. So yeah, I think everyone's kind of said the same thing here in terms of the messaging and being appropriate to the channel that we use.
Can I answer? Another thing that's come through on those messages that's really interesting is how much it's social media and how much I think things like posters and things are going to local businesses, and whether that should come from council going around to get those up there or us. I know a couple of businesses I could ask to put posters up, but we need stuff that's suitable. That comment about Facebook, it is the social media market matched with the poster market. They're two different things. I think two different worlds almost.
Yeah.
And again, earlier today we had a colleague from the Merton Chamber of Commerce and Love Wimbledon, who were going down the Wimbledon High Street, going into the businesses, talking to them about the QR codes and all those different things. And then I spoke to a colleague in the council earlier this afternoon, and they're going out to Mitcham businesses tomorrow to do a similar thing. But again, it's how we can kind of support those businesses to be compliant. Should we come back to Ian's? I think it was Ian's question and some of the colleagues about the app and the challenges. I think it might have been Sue actually, about the press over the weekend. Essentially, it wasn't great, was it? I think it's really important that these community champions meetings are honest, informal where they need to be, and that's absolutely fine, because these are real things that we need to live with and work through. We've been told that is going to get better. So if you hadn't seen the story, essentially, if you had a test from some of the private coronavirus testing labs, you weren't able to put it on the app and then benefit from the electronic test and trace. We've been told that that's going to get sorted. I haven't seen my app on my phone update yet. But we will keep an eye on that, and as soon as we know anything, we will let champions know, and I'm sure that we'll probably do some local comms as well. it will get better. Please persevere with the app. It is going to keep us all safe. It is going to make a difference. I think clearly it will improve. That's all I can kind of really say. And were there any other questions about the app specific or comments on the app?
I think it is actually, and it's typical of the British approach that they're always, the media want to highlight what's wrong, as opposed to celebrating what's right. I mean, 13 million downloads, that's fantastic.
It is.
Why haven't I picked that up anywhere else?
Can I just ask one question? Because I read an article that said it's not much use for tracking and tracing, and I thought, what? And I know that all the data is stored on the phone. And I probably didn't take in everything last week. Is it given a unique number, and therefore, if something happens, track and trace contact you via that? That's what I don't understand. Because if it's not going externally, how?
Okay.
That's something that I thought, then that's really not as useful as I thought it was going to be.
Okay, it is definitely an electronic version of tracing, contact tracing. It doesn't track your movements, but the app would pull up a random code that and it pings via Bluetooth to another phone, for example. And if you're within close proximity of another phone that says this is the phone of someone that's tested positive, it then through anonymously is able to send a message through to the other phone saying you've been in contact with someone that has a positive test and you need to self-isolate.
But nobody else will ever know that. Well, that's my point, isn't it?
Yep. They don't know
sure how useful that is, actually.
It's incredibly useful because, again, think about in a setting, if someone has a positive case, then through the electronic version of test and trace, it can notify 5-10 people that have been in close proximity for that 15 minutes as a close contact and advise them to self-isolate. Then you'll get that update and saying you need to self-isolate, and if you get symptoms, get a test. And again, you can get the test through the app. So it is a really useful tool. It's the icing on the cake. A public health person talking about cake's never good, but it is the icing on the cake for the test and trace service. Okay.
I just saw Sue had a question there.
Yeah, it was just to say that that's, I think, where I got, because when we first did this session about the app, it seemed all completely crystal clear to me. And then that's what I got a bit confused about, is if people can't upload their test results to it, except for a small number of people, how is it going to be able to notify you if you've been in contact with if you happen to have been close to somebody else who's tested positive? Because it's just going to ignore vast numbers of people who might not be able to put their test results in, presumably. So that's why I suppose I'm a bit confused about how effective it can actually be at the moment.
Yeah, it's going to get more effective as more people download it, and once they fix that particular issue with the app.
Yeah.
Okay. You're spot on, so you really are. You're right.
So it's just to tell people really that,
Stick with it. The app's going to be improved, like all of the apps that we've got on all of our phones for mobile banking and various things. They improve over time. We've identified, or the National Public Health Team, this is not a Merton Public Health Team app. The National Public Health England have picked up an issue, and we'll be working hard to resolve it. But keep with it.
Thank you.
But I think I'm right in saying, am I not, that you can upload test results? It's a very small percentage of test results that you can't upload.
That's correct.
That's what everybody's focused on.
It is. Yeah, that's right, Ian. I'm looking at the time, and because I took us off agenda to get everybody introducing themselves, and a really fascinating discussion, I think we're a little bit behind time. Eleanor, have we got problems with the slide?
So I'm sorry, everyone. I'm trying to figure out still how to play a video and for you all to be able to hear it without you having to click the button. I still haven't got there just yet, so bear with me this week, and hopefully next week I'll be on top of it. but I'm about to show you. So this workshop theme is about keeping Merton safe, and it's based on the guidance as of today. So, bear in mind when we do send the slides out in a week or two, if the guidance changes, this is only as of today, really. So it'll be in date until guidance if it changes, if that makes sense. So the next slide is a video, and I'm going to ask you to press the play button on your screen, and if you could mute yourself when you're playing it. If it works, could you just give me a nod for those that have their videos on, please?
So, Una, all I can see is a white screen with a circle that's going round.
Has anyone else been able to play the video?
Yeah, I have. I just clicked on it.
Touching your hands will reduce
It's working for me.
catching or passing it on.
It's working for me.
Has everyone seen the video?
Yeah.
Yeah. Okay, perfect. Yes, as I said, hopefully next week I'll be able to share it with you without you having to press anything. So I'm going to talk you through the rule of 6. So the rule of 6 is to help prevent the spread of COVID-19. You should not socialize in groups bigger than 6. This means meeting in groups of 6 or less, following social distancing guidelines when you do meet, and limiting the number of people that you see socially over short periods of time. If you can meet outdoors, if possible, as this provides better ventilation. So I've put together here some of the frequently asked questions that we can go through. I think the rule of 6 can be confusing in different scenarios and situations. So the first one is, can I visit people indoors? So yes, you can. You can socialize with people that you don't live with indoors in groups of up to 6. If you live in a household of more than 6 people, or your support bubble is larger than 6 people, you can gather together. But you should continue to social distance with anyone that you don't live with. Can you use public transport if seeing friends and family? So you can. It's advised where possible to walk or cycle, but if not, you must wear a face covering while on public transport. Are children counted in the group of 6? So yes, they are. Can I stay overnight in someone else's home? So yes, you can stay as long as you don't form a gathering of more than 6 people, unless it's with your support bubble. So people in the same support bubble can stay overnight with each other in larger groups as they count as one household. Can you look after your grandchildren? Yes, people in groups of up to 6 can meet indoors and outdoors, which enables grandparents to spend time with their grandchildren, although this may mean for some whole families may not be able to meet all at once. How many people are you allowed to meet outdoors? So you can socialize in groups of up to 6 outdoors. If your household or support bubble is larger than 6, you are not permitted to meet with any additional people. You should continue to maintain social distancing with anyone that you do not live with. And can more than 6 people be in a pub, restaurant, or place of worship all at once? So venues following COVID secure guidelines can host more than 6 people in total, but you should not visit in a group greater than 6 unless you're all from the same household or support bubble. So I hope that makes it a little bit clearer. I've included here as well a slide on the exceptions to where groups can be larger than 6 people. I'm not going to go through it in detail because there's quite a lot there, but we'll include it in the slides and share those with you on Friday, so you can use this as a reference point of where groups more than 6 can gather. Places like work, childcare, if you're providing support to a vulnerable person. There's quite funerals. There's quite a few exceptions.
And Una, sorry, just to come in there again, this is one of the things that we really struggle with. We are sociable people. We want to spend time with other people. We really do. And the rule of 6 is limiting that for the right reasons. This is an important one. And what you will have seen in the press and the stories about those towns, remember those 3 different levels of concern, so area of concern, additional support, and then areas of intervention, is that many towns are being asked that as the rule of 6 doesn't matter, it doesn't count, it's been overridden, and now we should not be mixing those households. And so if we don't follow the rule of 6, we might end up getting further additional measures put on us as Londoners, as Merton residents, to prevent household mixing. So it's going to be really important for us to follow these messages. I kind of said at the start that we're talking about very simple messages, but these are the things that do prevent the virus transmission or break chains of transmission. Okay, sorry, Una.
No, it's okay. So I'm going to talk you through the social distancing, which I'm sure everyone is already aware of. But as Barry said, it's just reiterating those simple key messages. So to reduce the risk of catching COVID-19, try to keep at least 2 meters away from people that you don't live with. Social distancing can help stop the spread of the virus, as it's more likely to spread when people are close. An infected person can pass on the virus even if they don't have symptoms through things like talking, breathing, coughing, or sneezing. If you can't stay 2 meters apart, you should stay at least more than 1 meter apart, as well as taking extra steps to stay safe. So wearing your face covering, moving outdoors if possible, it's safer. And if you are meeting people indoors, try to make sure the rooms are well ventilated, keep windows and doors open. You don't need to socially distance from anyone in your household. You don't need to socially distance from anyone that you're in a relationship with or that you are in a support bubble with either. So it's about meeting those people outside of the home to make sure that you keep the 2 meters or at least 1 meter away from. So this slide is wearing a face covering, which someone, I think Angela, you brought up earlier on today. It's like it's about those simple messages again. Oh, sorry. So COVID-19 is usually spread through droplets from coughs, sneezes, and speaking. And these droplets can be picked up from surfaces and spread. So if you touch a surface and then your face without washing your hands first, you're potentially spreading that virus. And that's why the social distancing, hand hygiene, and wearing your mask is so important. It's the 3 together. And the best available evidence that we have is that face coverings can reduce COVID-19 droplets in certain circumstances. So I've included a diagram here about how to wear a face mask. I'm sure everyone's heard and seen it before, but to reiterate, it's to make sure your hands are clean beforehand, wash them with soap and water or hand sanitizer, holding the coloured side of the mask away from you, and holding it by the loop so you can loop onto your ears without touching the mask itself, molding the stiff edge up into the top, the bridge of your nose to make sure it's covering your nose and your nostrils, and pulling the bottom over your chin to make sure it's covered your mouth and chin, and just to avoid touching your face in the mask while you're wearing it. So when to self-isolate. So self-isolation is when you don't leave your house because you may have COVID-19. This helps stop spreading the virus to other people. So you're asked to self-isolate immediately if you have any of the COVID-19 symptoms, such as a high temperature, a new continuous cough, or a loss or a change to your sense of smell or taste. If you have any of these symptoms, request a test via 119 or using the link here, the government website. If you've tested positive for COVID-19, you're asked to self-isolate. If someone you live with has symptoms or has tested positive, you're asked to isolate. If someone in your support bubble has symptoms or has tested positive, again, you're asked to isolate. If you're told to isolate by the NHS Test and Trace or the app, the NHS COVID-19 app. And when you arrive into the UK from a country which is a high risk. So we've included the website link here that you can use to check the countries that this is the case for. How to self-isolate. So self-isolating means you must not leave your home. You don't go to work or to school or public places. You don't use public transport or taxis. You don't go out to get food or medicine. You're asked to order it online or by phone or ask someone to bring it to your home. You don't have visitors into your home, and this includes family and friends. But the exception is if you have someone providing essential care. And you don't go out to exercise. You're asked to exercise at home or in your garden if you have one. And we've just included the Merton Community Response Hub here for anyone who needs support while isolating. They can contact MVSC here. So that's a really quick whistle-stop tour through the basic guidelines of the rule of 6 and how to wear a mask and isolate. And just to start the discussion on this, I'm quite conscious of time as well. Has this helped anyone? Has it made the guidance clearer, or has it helped with understanding any of the things you may have been confused about? Does anyone want to provide any feedback?
Shall I answer some of those questions that you put in the chat, which are really helpful and related to the face coverings? Sorry, Ian, we were going to come in there.
No, I wasn't. I mean, I'm just going to answering you this point. You didn't say anything that I didn't know, but actually there are a lot of people out there who need to understand, because I think we're converted. It's how we get that message out to the people who don't get it.
It is, and again, I say kind of on a regular basis that Barry Causer wearing his suit and his Merton Council badge has no reach into communities at all. What we need to do is to grow this type of approach with our network of community champions. We've got 57 people registered so far. We need to grow that so we can get those messages out. We need to use the My Merton, the magazine. We need to use the mutual aid network, the Dons network that we heard about earlier. Neighbourhood Watch have fantastic networks. We need to kind of piggyback on this. The fantastic volunteers and the assets that we have in Merton, to be honest with you, to get those messages out.